clinical, presentation to diagnosis. A skin prick test is not available in all the institutes, and you need to try refer the patient to other maybe you can try, but try go to health. What's the level of diagnosis? There's no single label test. Delayed symptoms, sometimes overlap symptoms, and there is the quality of life, all of these issues. ESPGHAN recommendation, to depend on the clinical, improvement, and to try some, formula and 4 to 4 weeks and observe, and you can diagnose those baby. For breast, elimination in the diet for the breastfeed mothers, you can give time 2 to 4 weeks, then you can resume it again to confirm the diagnosis. And as I mentioned, this is can confirm if we have facility to do that. Oral test. For the exclusive breastfeeding, you can eliminate the diet if the mother give baby her breastfeeding, then reintroduce it if you develop that one is confirmed diagnosis. For those who's non-breastfeeder, you can try excessive hydrolyzed formula or hydrolyzed rice protein formula, whatever, but goat milk is not treated for allergy. If you have anaphylaxis or severe one, you can immediately go to amino acid formula. Breastfeeding is the most important, and is breastfeeding to treat, to continue that one should not be stopped. And the impact breastfeeding for growth, for nutrition, for gut microbiota, decrease infection, and other major or component, the protein, carbohydrate, and lipids. The minor is important. The hormones, the cytokines, interleukin 10, and so on. This has impact on children to improve their or decrease the allergy for them. And it's other CBOP and so on, DHA, how that hormones has impact in our babies in our body for the breast milk. And this is why we have to carry the breast milk, because benefits which I missed in the previous slide that also support the baby. How? As we mentioned, the maternal antibodies, they have idiopathic antibodies like interleukin 10, beta 2, and also hormone and growth factors can also have gut maturation, and also the CBOP also, and can help in that one. It's the bio component. Lactation should be continued for children up to 4 to 6 months, and the breast milk has also got controlled protein exposure, and also they have gut microbiota modulation, which has pre and probiotic, which has impact on the baby gut, which decrease allergy. Other thing for management option for non-breastfeeding, as you see here, for the anaphylaxis, you can start amino acid. For those who's intermediate or they are not sick, you can also start either extensive hydrolyzed formula, or you can try a rice protein or formula, which is the evidence-based medicine that one was seen coming slide. And why we could think about that one, because sometimes there's restriction in extensive hydrolyzed formula, the taste, and there's some cross reaction, and they are not, the children, as you know, not tolerate that one, especially after 84 months, because they start to have a taste. They tolerate the rice hydrolyzed formula. There's paper, all of these from Drachma regarding that guidelines. The rice hydrolyzed formula can second line resource due to if there is not available for extensive or it is expensive, you can try this one, rice hydrolyzed formula. What is the hydrolyzed protein formula? It's the rice protein. It is raw materials, it's manufactured. The rice protein contains many very genotypes, and they are having more protein like albumin, globulin, and glutamine, and they are deficient in 3 amino acids. They were lysine, threonine, and tryptophan. Those amino acids not available. That one should be added to compensate the deficiency of that one. How they make this hydrolyzed rice protein formula, or from where they take the rice? The rice protein taken from the bran or for the kernels, and usually they made it from seed of that one. And that broken rice, they're rich in starch and contain endosperm and storage protein only. That protein high in rice bran, broken rice kernels, and they have rich protein, which protein of وليس protein كسر animal protein. So, enzymatic hydrolysis, they are 80% protein, 20% protein, and they are soluble water. There is lipid composition also, and there is carbohydrate also in that one. Rice is one of the less allergic, stable food. The reaction is 1%. No lactose and no phytoestrogen. For this reason, it has been developed as a non-allergic product in rice protein hydrolyzed. It is well known in Spain, number one, Italy, France, and the USA recently. They don't have essential minerals like isolation, lysine, threonine, and tryptophan. What about arsenic? We a lot of talk about arsenic in the rice, and this is a concern of some people. They reviewed in some papers and they found this amount is not affected, same amount found in other products. Evidence-based medicine, a lot of papers from different societies, DRACMA, and recommended using that hydrolyzed rice formula for as first line. Goat milk not treatment, again, extended formula as the first option. Hydrolyzed rice can be used. Amino acid for anaphylaxis, and soy formula can be used in some patients. This is a recommendation for them. Other paper to show the hydrolyzed rice formula is a great choice for common allergy as available and safe and cheaper than the other one. Relative low cost, good taste. There are two factors that can support this one. So it is a matter, we have a lot of things now. We have this one, we have exercise formula, we have amino formula, based on the clinical situation for that one and which one is available. If the patient has insurance, okay, and it's not the government who's available in hospital, you can use, for patient care and patient care, not because of any other reason, please. Conclusion, exclusive breastfeeding, 6 months of life, so the is 88.3% from our colleague of Hydrolyzed in the Asia region, and 20% from our colleague Dr. I forget her name, from King's University, which is good that increase. First paper was published in 2013, the other paper published in 2022, after COVID, which is good that there is awareness and increase the breastfeeding in Saudi Arabia. Breastfeeding can save about up to 800,000 baby from gastroenteritis per year, and breast milk has boosted back in both the photogyric disorder and the common allergy and should not be stopped. Please, anyone breastfeeding, continue breastfeeding. Support them, encourage them, help them. Don't stop breastfeeding, don't give any formula. Please, Allah Jazakum. Most abundant HMO, the breast milk, as you know, 2 and more than 200 breast milk, but which was used more than 6, 7, and recognized their rules. To provide immune support, encouraging immune cells, and it has implemented cytokine profile. This will diminish colon motor contraction, inhibit anti-pathogen adhesions, as you know, improve intestinal adaptation, and influence cognition behavior tasks for that study for the white and gray matter, and also increase expression of biomarkers associated with learning and memory. Thank you very much. I think we are done. Several factors that affect allergy, microbiota dysbiosis, as you mentioned, the factors, and again, either extensive hydrolyzed formula or hydrolyzed formula can be the first line to be used, but not go for that one. Thank you very much.